This is Sarah Clark with the National Poll on Children's Health. Most children receive care from a primary care provider. A PCP is a pediatrician, family physician, or nurse practitioner trained to provide well child care as well as care for a broad range of common childhood illnesses. When children show signs or symptoms of a more serious problem, PCPs often refer them to a specialist. We know that in some instances, a PCP makes a specialist referral, but the appointment doesn't take place. We wanted to find out if parents have a clear and consistent understanding of their role versus the role of the PCP in arranging that specialist appointment. We showed parents a list of tasks involved in arranging a specialist appointment and asked them to select who should be responsible, the parent or the PCP. As you can see in the figure, there's a consensus that the PCP should be responsible for providing medical records to the specialist. 84% of parents agree with that. Parents are much less consistent about whether the parent or the PCP should be responsible for verifying that the specialist appointment will be covered by the child's insurance, for choosing the specialist, and for making sure that the wait time for the appointment isn't too long. There's no clear consensus over whether those tasks should be handled by the parent or the PCP. When asked to rate the importance of different characteristics of specialist referrals, parents were much more consistent. 89% said it was very important that the specialist knows how to take care of the child's specific medical condition, and 80% said it was very important that the specialist be trained in pediatrics. The take-home messages from this poll are clear. First, some parents want to choose their child's specialist, while others want the PCP to have that responsibility. But regardless of who makes the choice, parents agree that the specialist's clinical expertise is the key factor. Second, primary care providers cannot assume that parents understand and are comfortable with arranging specialist appointments. Clear communication, ideally with instructions written in plain language, will be essential. Finally, for parents, it is imperative to ask for clarification about the process of setting up a specialist appointment and ask for assistance if problems arise. In this way, parents and primary care providers can work together to make sure children get the specialty care they need.